Hi guys, in this video we are going to discuss about multiple choice question in gingivitis. A thin bluish line around the gingival margin is due to the absorption of A. Silver, B. Mercury, C. Drugs like tetracycline, D. Lead. Answer: D. Lead. Heavy metal cause gingival pigmentation in area of inflammation only, where increased permeability permits the seepage of metal into the surrounding tissue. Lead line, Berta line. Bluish red or deep blue linear pigmentation in marginal gingiva. Silver, argyria. Violet marginal line. Bismuth, arsenic and mercury. Black marginal line. Mesetric line. Delicate, brown or black pigmented on non-karyotype plaque found on the enamel at the cervical margin of the tooth. McCall's festoons are A. Also called Stillmer's clefts. B. Due to poor oral hygiene. C. Congenital abnormality. D. Due to trauma from occlusio. Answer: D. Due to trauma from occlusio. Stillmer's clefts, apostrophe-shaped indentation from and into gingival margin. MCQ's festoon, life preserver-shaped enlargement of the marginal gingiva occur most frequently in canine and premolar area. Both Stillmer's cleft and MCQ's festoon are considered to be the trauma from occlusio. But this association was never substantiated. They represents peculiar inflammatory changes of marginal gingiva. Most objective sign of gingivitis is A. Increase in gingival size. B. Increase in crevicular fluid. C. Increase in gingival redness. D. Bleeding on probing. Answer: D. Bleeding on probing. The two earliest signs of gingival inflammation are increased GCF production rate, bleeding on probing. Bleeding is a more objective sign that requires less subjective estimation by the examiner. Lifesaver-shaped enlargements of the marginal gingival are called A. Gingival crater. B. McCall's festoon. C. Stillmer's cleft. D. Window peaks. Answer: B. McCall's festoon. McCall's festoon is a life preserver-shaped enlargement of the marginal gingiva. Most frequently seen on the facial surface of canine and premolar area. Which of the following cells are predominant in the stage 1 of gingivitis are A. Plasma cells. B. Neutrophils. C. Mast cells. D. Lymphocyte. Answer: B. Neutrophils. Stage. Time. Predominant cell. Findings. First stage, 2 to 4 days. PMNs. Increased GCF flow. Second stage, early or acute, 4 to 7 days. T lymphocyte. Vascular proliferation, erythema, bleeding on probing. Third stage, chronic or established, 14 to 21 days. Plasma cells. Bluish to reddened gingiva, changes in texture, size etc. Fourth stage, advanced. Connective tissue breakdown. The most common form of gingival diseases is A. Gingivitis. B. Periodontitis. C. Gingival recession. D. None of the above. Answer: A. Gingivitis. Gingivitis is the most common form of gingival diseases. Only some case of gingivitis progress to periodontitis. About 90% of population is affected by gingivitis by the time they cross the puberty. Earliest clinical sign of gingivitis is a. Bleeding on probing. B. Change in color. C. Change in contour. D. Change in size. Answer: A. Bleeding on probing. It usually appears after 1 week from the beginning of plaque deposition. In this stage, the clinical signs of gingivitis, such as redness and bleeding from the gingiva, start appearing. Which single factor could contribute most of the development of simple gingivitis in children? A. High fever. B. Poor oral hygiene. C. Oral habits. D. Physical nature of food ingested. Answer: B. Poor oral hygiene. Local conditions such as materia alba and poor oral hygiene favors the accumulation of plaque. Calculus formation is less common in children. Generalized calculus formation occur in cystic fibrosis. This is related to the increased concentration of phosphate, calcium and protein in saliva. When PD probing in gingivitis done, depth is measured form: A. Base of the pocket to sedge. B. Base of the pocket to free marginal gingiva. C. Marginal gingiva to sedge. D. Junction epithelium to free gingival margin. Answer: B. Base of the pocket to free marginal gingiva. In gingivitis is no true pocket formation. Whenever the probing depth measured is the depth of the gingival sulcus. Bacteria found in gingivitis are localized in A. Connective tissue fibers. B. Gingival sulcus. C. Alveolar bone. D. Periodontal ligament. Answer: B. Gingival sulcus. Bacteria found in gingivitis are localized in the gingival sulcus. There is no connective tissue invasion. In periodontitis, the microorganisms are localized in connective tissue and results in periodontal destruction. The histopathological picture of chronic gingivitis. A. Leukocyte infiltration with increased neutrophils. B. Widening of capillaries and venules. C. Increased plasma cells and neutrophils. D. Infiltration of neutrophils, lymphocytes and plasma cells. Answer: D. Infiltration of neutrophils, lymphocytes and plasma cells. Egglement of blood vessels, bluish-red appearance of gingiva and changes in the size, texture are the clinical feature in stage 3 or chronic gingivitis. Histologically, there is infiltration of connective tissue and junction epithelium with neutrophils, lymphocyte with predominance plasma cells. Gingivitis. A. Inevitably progresses to periodontitis. B. Affects approximately 40% of adolescents. C. Is characterized by true pocketing. D. Is a reversible lesion. Answer: D. Is a reversible lesion. Gingivitis is an inflammatory condition of the gingival tissue most commonly caused by bacterial infection. Unlike periodontitis, there is no attachment loss and therefore no migration of the junction epithelium. This activity describes the evaluation and management of gingivitis and highlights the role of the interprofessional team in managing patients with this condition. Gingivitis is initiated most frequently by A. Pregnancy. B. Malocclusio. C. Vitamin deficiency. D. Local irritating factor. Answer: D. Local irritating factor. This is the most common cause of gingivitis. Plaque is a thin film that forms on the tooth surface due to poor oral hygiene. If not regularly removed, it can harden up and form calculus. As plaque harbors a large number of bacteria, inflammation can occur in the gingival tissue. The most common sequel of gingivitis: A. Perichoroitis. B. Periodontitis. C. Periodontosis. D. Periapical pathology. Answer: B. Periodontitis. Extension of inflammation into the supporting structures occurs in stage 4, advanced gingivitis, which is the phase of periodontal breakdown. Periodontitis is always preceded by gingivitis, but all gingivitis progresses to periodontitis. The transition from gingivitis to periodontitis occur with increases in the number of spirochetes, motile organisms, and when the prominent T-cell lesion becomes a B lymphocytic lesion. MCQ's festoon are seen in which teeth? A. Central incisors. B. Canine and premolar. C. Lateral incisors. D. Molars. Answer: B. Canine and premolar. McCall's festoons. These are lifesaver-shaped, semilunar enlargements of the marginal gingivae primarily on the labial surfaces of the anterior and premolar teeth. Clinical signs of gingivitis appear in: A. Initial gingivitis. B. Early gingivitis. C. Late gingivitis. D. Advanced gingivitis. Answers: Early gingivitis. Early lesion. It usually appears after 1 week from the beginning of plaque deposition. In this stage, the clinical signs of gingivitis, such as redness and bleeding from the gingiva, start appearing. Which of the following is not influenced by systemic diseases? A. Periodontitis. B. Destructive periodontitis. C. Hereditary fibromatosis gingivitis. D. Chronic gingivitis. Answer: D. Chronic gingivitis. A key feature that differentiates stage 3 gingivitis from the stage 2 lesion is an increases in the number of: A. Lymphocyte. B. Plasma cells. C. Mast cells. D. Polymorphs. Answer: B. Plasma cells. Stage 2, early periodontitis, inflammation of the gingiva, gums, and the surrounding tissues that results in early bone loss. Stage 3, moderate periodontitis, inflammation of the gingiva, gums, and the surrounding tissues that results in moderate bone loss. McCall's festoon results from: A. Normal physiological process. B. Toothbrush trauma. C. Inflammation. D. Food lodgement. Answer: C. Inflammation. As a consequence of recession, the remaining attached gingiva may become somewhat thickened and rolled. A non-inflammatory fibrotic response known as McCall's festoon. Apostrophe-shaped area. A. Stillmer's cleft. B. McCall's festoon. C. Gingival sulcus. D. None of the above. Answer: A. Stillmer's cleft. Stillman's clefts are apostrophe-shaped indentations extending from and into the gingival margin varying distance on the facial surface. The etiology of this cleft is still not clear. They may repair spontaneously or persist as surface lesions of deep periodontal pockets that penetrate into the supporting tissues. Stay tuned and subscribe to Dentology Notes for new videos. Thanks for watching.